My name is Maria McFarland Sanchez-Moreno. I'm the Executive Director of the Drug Policy Alliance. The ideal drug policy for a country is very hard to describe in detail because there's so many different pieces to it. But I think the most important thing to say is that it should be focused on prioritizing human lives and the well-being of human beings. Right now, U.S. drug policies are focused on criminalization and enforcement and end up doing much more harm than good. I would urge that we develop new policies focused on providing supports, meaningful supports to people who need them and want them. So that would mean treatment, medication-assisted treatment for those for whom it's appropriate. It would mean access to services, help with employment, help with housing, help with other needs that people might have that may be contributing to their problematic drug use. At the same time, I think we would recognize that there are people who are using drugs non-problematically, and that's the vast majority of people, not just with marijuana, but other drugs. And for those people, we should be providing education, we should be providing assistance to reduce any potential harms that may stem from their drug use. You should be providing drug checking services to ensure that people are not consuming adulterated products. But ideally, you would also have regulatory systems in place for marijuana and other drugs that would ensure that products are as safe as they possibly can be, and that people are not having to go underground and engage in very risky behavior in connection with their drug use. Again, I think it's complicated to set up a legal structure around drugs. I think the number one issue that I would push for in the United States now is just to decriminalize the personal use and possession of drugs. The drug trade is a much more complicated thing to talk about regulating outside of the context of marijuana, and that's something that needs to be figured out, and I don't have all the answers on that front.